With just 25 days until the election, President Trump's conduct and health continue to transfix Washington, with the Democratic House Speaker Nancy Pelosi so alarmed that she has raised the constitutional stakes. Earlier Friday, the Speaker announced she supports the creation of a commission on the 25th Amendment, focused on evaluating whether the president is fit to serve. In response, the president's allies have lashed out at her, saying she might be orchestrating a coup. And the president has been pressuring his own cabinet officials, such as Attorney General William Barr, to indict his opponents. In short, it is political war, coupled with deep national anxiety over a pandemic that has killed over 210,000 Americans. And stimulus talks are sputtering, and the White House has coronavirus spreading among top officials. Joining us to discuss this serious and turbulent American moment are three of Washington's finest journalists: Yamiche Alcindor, White House correspondent for the PBS NewsHour; Susan Page, Washington bureau chief for USA Today and the moderator of Wednesday's vice presidential debate; and Jerry Seib, executive Washington editor for the Wall Street Journal and author of We Should Have Seen It Coming: From Reagan to Trump, a front row seat to a political revolution. Yamiche, I'd like to begin with you and congratulate you on winning the International Women's Media Foundation's Gwen Ifill Award. You certainly embody Gwen's spirit and her commitment to the truth. Congratulations. And let's turn,
Thanks so much, Bob.
Let's turn, Yamiche, to the latest news. You've been following it for the past hour. On Friday, several outlets are now reporting that the president will speak from the White House balcony on Saturday and then hold a rally in Florida on Monday, even as he recovers from the coronavirus. What do you know about his health tonight? And is there any dissent inside the West Wing about these events?
Well, first, I just want to say congratulations to Susan for moderating that debate. It was an amazing thing to watch, and I'm happy to be on TV with you tonight. I think that the president is clearly very, very eager to get back on the campaign trail. He's very much wanting to look in charge. He's tired of being in the White House, tired of being confined to that building. We don't know some critical things about the president's health. In particular, when was the last time that he tested negative? The White House has refused over and over again to answer that question. We also don't know if he's had any lung damage, if anything that has happened to him as a result of his COVID-19 diagnosis has actually compromised any part of his health. His doctor has not answered questions since Monday. We've been getting written updates about his health, but there are a lot of unanswered questions about where the president stands. The White House insists, the White House doctor in particular insists, that the president will be okay to start having events on Saturday. As a result, we're seeing the president and the White House hosting, they're not calling it a rally, they're saying that it's the president doing remarks on law and order, but we can imagine that there are going to be, if not dozens, if not hundreds of people at the White House tomorrow. There are people in the White House who are very scared. People have been freaking out all week long, Bob. I'm sure you've been hearing this. People lining up to get tested with so many different people. We have something like 35 people at least who tested positive at the White House recently. So people are really, really scared. But the president tomorrow is deciding that he wants to be out front because he's seeing Joe Biden hit the campaign trail.
Susan, I'd echo Yamiche's comments. Terrific job at the debate. Yamiche also mentioned, Susan, the president could be giving remarks on law and order, and we're seeing him not only restless, but raging. He's been tweeting and making comments on Rush Limbaugh's show and Fox News about how he's frustrated with his own attorney general about the lack of a Durham probe at this point in the campaign and the lack of indictments. What does that all say about the president at this time?
Well, I think it shows the president in a state that I think even for President Trump, who has been a disruptor from the start, it's part of his brand, has moved on to new territory to be running for re-election a month out from the election, pretty far behind by double digits in the last 4 high-quality polls that we've seen nationwide, suggesting that he would use, suggesting that he should use the Justice Department to meet his political agenda, to cause damage to his political opponents, even to political opponents of the past, to the Obama administration, to President Obama. This is really quite quite extraordinary. We talk about tumultuous times. It's hard to imagine a more tumultuous time in American history, maybe since the Civil War, where we approached this election with such high degrees of anger and angst on the part of so many citizens.
Jerry, will the Attorney General, Bill Barr, will he buckle at the president's demands?
You know, I don't think so. I think Bill Barr has shown that he's sympathetic to a lot of the demands that the president places on him, but he's not his handmaiden in any way. He's said this week, apparently, has told Republican lawmakers that the inquiry into the origins of the Russian interference election is not going to be interference in the 2016 election is not going to be done in time for this election. That's not making the president happy, but that's an action Bill Barr has taken. I think the sort of the broader thing that we have learned here in the midst of all this is that the coronavirus, I think, is now cemented as the dominant question, the dominant issue of this campaign. I mean, that's what this is all about. This is the president's frustration at being bottled up because of the coronavirus, the inability to avoid talking about the coronavirus, which I think the Trump campaign was eager to talk about anything else for weeks. Now it can't avoid the question. It was the dominant topic in the debate that Susan moderated. And again, I would also add my congratulations to Susan for that. This is now the coronavirus election. And one of the reasons you're seeing the president moving out in all these different directions is that frustrates him.
Yamiche, Jerry said it's the coronavirus election. It's also the coronavirus West Wing at this point. You said people are freaking out. How is that affecting the effectiveness and the function of American government?
It's really remarkable. You have all but one of the chief of staff, the Joint Chiefs of Staff, quarantining. You have at the White House a number of high-level officials testing positive, including, of course, the president, the first lady. You also have the White House press secretary. You also have the Trump campaign manager. There are a number of people who helped the president during the debate who also have tested positive, including Stephen Miller and Chris Christie. Chris Christie, the former governor of New Jersey, he's someone to really watch because he's still in the hospital. He's also said that he didn't hear specifically from the White House, and that gets to the issue of contact tracing. One of the things that this White House is supposed to be doing is looking at how this all got started. There, of course, was that Saturday event to announce the nomination of Judge Amy Coney Barrett to the Supreme Court. There are a couple of other sessions, including a debate session, that people think that there might have been a hotspot area in that as well. But this is a White House that is not taking outside help to do contact tracing. So the CDC has said, we would be happy to help you, but the White House says they have an in-house epidemiologist. But just based off of what I've been talking to and who I've been talking to, people aren't clear on exactly how much that contact tracing is going to go into all the different people who have already been touched by this virus. So really, the White House is functioning in chaos. The press secretary is not able to give briefings because she's literally at home quarantining. And the president, he's walking around the White House kind of restless, going into the Oval Office, but people are going to have to, or people have had to put on almost full hazmat suits to be able to interact with him. So that's also frustrating the president. So this is a White House that's trying to function, trying to say that things are business as usual. But Bob, they're anything but business as usual.
And Dr. Fauci, Susan, said earlier today on CBS Radio that Amy Coney Barrett announcement last week was probably the super spreader event for all of these White House officials. Susan, you're not only a debate moderator, you're a biographer. You're writing the book about Speaker Pelosi. She has raised these constitutional stakes, talking about the 25th Amendment, about whether Congress should help advise the executive branch in some way about the fitness of a president to serve. What is she up to here just 25 days before the campaign ends?
Well, of course, these are serious concerns. It's not unreasonable to look at questions of succession. However, the timing of this makes it look pretty provocative. The Speaker Pelosi at the announcement today of her support for this bill that Congressman Jamie Raskin has put forward said it wasn't directed at Trump, but she indicated it was motivated by Trump, that she has long expressed concerns about the president's fitness for office, and most recently about whether the drugs that he's taking to treat COVID-19 might be affecting his judgment. So I think there is no chance that this bill gets passed anytime in the foreseeable future, but it is certainly something that has focused our attention on the president and his fitness and COVID-19. And those are all bad issues for him just 3 weeks before Election Day.